Hello, and thank you for joining me for Module 3, Becoming a Mentor. How do we become a mentor? Why is it important? And what's in it for the mentors? As we begin this module, think back to our clinical scenario with our experienced and new therapists. We now have the perspective of knowing what generational factors may play into the mentoring relationship. And in the previous module, we discovered how considering learning styles can give the mentor another tool to help in the mentoring process. With that scenario in mind, let's add the next component to an effective mentoring relationship. What is a mentor? A mentor is someone who is more experienced, taking a less experienced individual under their wing to help to teach, guide, and support them in the lifelong learning process. As hand therapists, there are a wide variety of skills and knowledge necessary to be effective hand therapists. We spend several hours each year attending continuing education courses to continue to expand our knowledge and skills. We spend countless hours reading articles, practicing various treatment techniques, and working to continue to be the best hand therapists for our patients that we can be. But even with all of this expertise, that does not necessarily mean that we have the educational skills necessary to pass on that expertise and teach what we know about hand therapy to others, nor does it guarantee that we know how to guide them through their early careers through mentoring. Being an effective mentor also requires specific knowledge and skills. The aim of this module is to provide the experienced hand therapist with evidence-based tools to help them gain the knowledge, skills, and confidence and the desire needed to teach and mentor the next generation of hand therapists. By the end of this module, the learner will be able to name the important characteristics and skills needed to be an effective mentor, identify strategies that are important to building an effective mentoring relationship, and finally be able to immediately apply the strategies learned to a mentoring relationship within the clinical setting. As mentors, our focus should not only rest on merely passing on our expertise to the mentee. Our focus should also be on building a relationship. The mentoring relationship is a collaborative partnership that is mutually gratifying, built around a common challenge or area of interest. A collaborative mentoring partnership is a meaningful exchange between the mentor and mentee for the purpose of furthering shared objectives in practice, education, or research. Mentoring is a two-way process in which both the mentor and the mentee are invested and willing to learn. Both must be ready to receive and give within the mentoring relationship. As this is a mutual relationship, each should be able to both offer and accept criticism in a respectful and productive manner. The mentoring relationship should be nurturing, built on trust and mutual respect, and provide guidance with the goal of growth in the mentee so that they are able to function more fully and effectively as a professional. It is important to establish expectations early in the relationship. What does the mentor expect from the mentee? And what does the mentee expect from the mentor and expect to get out of the mentoring relationship and process? It is recommended that a mentoring contract is made at the beginning of the mentoring partnership to help create a quality mentoring experience. In the contract, it is important that skills and behaviors expected from both parties are included. This is a good time and place to set goals, establish structure, and determine the preferred teaching and learning strategies for both the mentor and the mentee. Examples of mentoring contracts can be found online. HTCC has a sample mentoring contract specific to hand therapy included in their peer mentoring handbook. Scan the QR code for a link to the HTCC website, which will take you to the handbook. The mentoring relationship also serves to enhance professional development. In addition to the clinical knowledge gained from the mentoring relationship, there are many other skills learned that contribute to the overall professional development in the mentee. First, it is important to provide adequate supervision. This can be difficult due to productivity demands in the clinical environment. However, Lack of adequate supervision for the new therapist can create an obstacle to professional growth and development. Without a mentoring relationship, many new therapists do not have adequate guidance when beginning their careers. The mentoring relationship serves as a formal way to ensure the new therapist has sufficient supervision. Realities of a busy and at times stressful clinic environment can be discouraging and overwhelming for the novice therapist. As a result, it is important to help them learn time management skills to manage a busy caseload, complete documentation, and have time to work on clinical reasoning skills and process what they are learning. New therapists often feel like they do not have enough time for these tasks. An effective mentoring relationship provides support for the new therapist as they learn to navigate patient care, along with the other demands placed on therapists in a busy hand therapy environment. Building professional relationships with other therapists, physicians, case managers, and other members of the healthcare team is an important part of the professional development of new therapists. An effective mentoring relationship provides opportunities and the time to help foster these important professional connections and improves communications and mutual respect between coworkers, which ultimately improves patient outcomes. Finally, the mentoring relationship encourages evidence-based practice and provides the new therapist time for continuing education and CHT exam preparation. Strong, healthy mentorship connections are crucial and should not be underestimated and can give benefits to both professionals that can last a lifetime. Ultimately, these relationships help ensure that the specialty of hand therapy continues as a valid specialty and valued specialty. An effective mentoring relationship creates an environment for learning that is targeted toward the mentee. The mentor should create a supportive environment that provides a space for learning. The novice therapist will need the opportunity to ask questions, they will need time to process what they are learning, and be given a safe space to develop, make mistakes, and learn from them, and be given ongoing opportunities for growth. Learning opportunities should be both planned and authentic. For example, if a patient is coming in for an orthosis unfamiliar to the novice therapist, plan time for them to process how to make the orthosis and ask questions prior to making it on the patient. If resources are available, provide the therapist time to practice making the new design before the patient comes to the appointment. Ultimately, the mentee is an adult learner and responsible for their own learning and their own personal and professional development. The mentor's responsibility is to encourage the mentee through the learning process and to enable them to take charge of their own learning and thus propelling them into a cycle of lifelong learning. To build these strong relationships, mentors should emulate a variety of characteristics. Effective mentors are motivated by concern and caring for the mentee. They are encouraging, they are welcoming, and they are supporters and advocates for the mentee. In addition, mentors should be prepared and competent in their teaching role. They are approachable, and they are willing to help. Effective mentors encourage the mentee to ask questions and give guidance to help them find answers. Experienced therapists serving as mentors should make themselves available and include the mentee within the clinical setting. They should enable them, develop them, and check in regularly to monitor the mentee's progress. Effective mentors give constructive feedback in a positive manner and use their skills and expertise to guide the new therapist in developing the advanced skills and critical thinking skills necessary to not only pass the CHT exam, but to also provide excellent care to their clients throughout their careers. Effective mentors want to see the mentee succeed and build passion for the profession. Lastly, effective mentors are an example, and they model the behaviors they seek to instill in the mentee. They provide excellent patient care, use evidence-based treatment techniques, and continually strive to further and advance their own knowledge. While highly important and needed, being a mentor and fully investing in a formal mentoring relationship does come with challenges for the mentor. Productivity expectations, along with heavy workloads in a dynamic hand therapy clinic, can leave little time for a lunch break sometimes, and even less time for mentoring. Adding the responsibility of mentoring in a busy, stressful clinic setting can be challenging for the mentor. However, this can be beneficial to new therapists as they are able to learn in a real-world environment. The added responsibility and time commitment is something that every mentor should consider before entering into a mentoring relationship. The mentee should also understand and consider the commitment the mentor is making when they take on the mentoring role. Organizational support and managers who prioritize the learning environment are an integral part of the mentoring process and ultimately in the advancement of the profession. This can present a conflict as patient volume and patient care are their first priority. Some managers may not see the importance of formal mentoring in the clinic. In order to support learning in a busy clinical environment, therapists, management, and the organization must acknowledge the value of learning, not only for advancement of the profession, but also to improve quality of care and patient outcomes. Mentoring has been shown in the evidence to improve overall quality of care, patient outcomes, and benefits to the organization as a whole. In a scoping review of mentorship of healthcare workers by Schwertl et al. In 2017, the findings indicate that quality of care improves where mentoring programs are implemented. A study by Magay et al. In 2015 found that formal mentoring contributed to an increased number of patients seen, along with significant improvement in assessment and treatment. Worknet et al. In 2012 performed a study pre- and post-introduction of a mentoring program and found that quality of care improved after the mentoring program was introduced. In a study by Manzi et al. In 2017, findings revealed that mentorship leads to improvements in quality of care, evidence-based decision-making, leadership, accountability, and employee satisfaction. Mentorship can also improve employee morale and foster communication and mutual respect between coworkers. In a systematic review performed by Halter et al. In 2017, mentorship was also shown to improve retention rate among healthcare workers. Anatole et al. In 2013 found that mentorship not only improved quality of care, but that mentoring was also a feasible and cost-effective thing within a clinic. These studies support both the need for mentorship programs and its benefits to the organization, and can provide evidence to support that managers provide time, space, and resources to support mentoring programs. While there are some challenges that come with mentoring or even limit mentoring opportunities, there are far greater rewards that make it all worthwhile. Being a mentor is a rewarding and life-enriching endeavor. Taking on this role gives individuals feelings of both personal and professional satisfaction and accomplishment. There are tangible benefits to being a mentor as well. Mentoring helps therapists to keep current with the direction of the profession and the latest evidence. Taking on this role also helps to promote deeper learning and develops stronger therapists. Mentors can develop an expanded skill set as they seek to teach the new therapist. New therapists often come with an attitude of excitement and passion for the profession that can be reignited and renewed in a seasoned therapist. A study by Allen et al. In 2006 found that being a mentor can also provide the therapist with greater subjective career success, such as self-satisfaction and accomplishment. In addition, the study found that mentoring contributed to increased salary and promotion rates. The mentoring relationship can evolve into a lifelong friendship. When I started out as a new graduate occupational therapist, a CHT hired me and took me under her wing and mentored me. 15 years later, I was still working with her. She recently retired, but to this day, she is still mentoring me, and I highly value our friendship, and it will last a lifetime. I like to think that through the years, she has learned a little bit from me as well. When therapists make the time and effort to be a mentor, they are contributing to something greater than themselves and helping to move the profession forward. Pause the screencast for a moment and take some time to reflect on the clinical scenario with the experienced and new therapist. Think specifically about how the strategies learned in this module could help structure the mentoring relationship. The primary goal for the mentoring relationship using the strategies presented in this module is to help mentees become independent therapists who are self-reliant, who can manage their own learning, are self-sufficient, and who can improve their performance both independently and continuously. The mentoring relationship is a rewarding and worthwhile endeavor for the mentor, the mentee, healthcare organizations, and for the profession as a whole. Thank you for joining me for Module 3 and seeking to learn more about how to be a mentor to contribute to the advancement of the profession. Here are some references for this module, and I will see you in the final module.